going to show you compression, which is also pectressage, but has its own separate name, where you are compressing the muscles. And this is a recommended stroke for the lower back, where you use the heel of your hand with the other hand on top to guide, and you very slowly push up through the latissimus dorsi onto the erector spinae, and then release as you go across the spine. And as in the case, as you will find when we're doing more work further up the back, you inch up the body bit by bit. I'm going quite speedily here, but it would be recommended to go as slowly as you can. This move is recommended for the part of the body here, which is between the top of the pelvic girdle and the lower part of the rib cage, where the tissue is soft and you don't meet any ribs. So we're talking an area that size. Keep that going as long as you like and repeat on the other side. Now we're going to use our knuckles for more compression, which is mobile compression, where you're working up the body. Again, note the fact that I'm standing as close to the area I'm working with the client, and my outside leg is the one pointing forward. The inside is close to the table. I'm going to use my hands and my knuckles to very slowly work up the body. Not on the spine, but immediately just off the spine. Starting just above the pelvis, not on the pelvis, and working slowly all the way up. Now I'm trying to keep my arms in the same position in relation to my body, and so therefore I'm moving my whole body up by bending my knees as I go. And if I have a very tall person, I can actually walk up. I would advise not doing this, because you lose control of what you're doing and you also hurt your back. When you come to this area of the shoulder blade, you don't want to maintain the same degree of pressure. You want to just ease off as you go up and over the bone, and then firm as you come down the other side, so that you don't lose the flow, but you don't get your fingers or your knuckles caught on the bone, or most importantly, hurt your client. So you've started centrally and you work outwards. Always finish a stroke off. Don't just go halfway up the body and stop, because that means that the person who's receiving that massage will feel that you've taken your hands off, and that will feel odd. Always finish your strokes. Always finish your strokes. I'm carrying on past the outer reaches of the shoulder blade to the area almost to the side of the body. The body doesn't stop at the shoulder blade. And these muscles here are equally as important and can be significant with people who lift and who carry and who do sports. And often when I've had a massage, these areas have been missed. And the massage has been restricted to this area here, whereas your body, of course, goes all the way around. Once you've knuckled up one side, you do the same on the other. I'm going to show you one additional thing, which is an ironing stroke, which is something more recent, and this is using forearms. Forearms are fantastic because they reduce the pressure on your hands, your knuckles, and your thumbs. And they also deliver a very solid, firm compression right the way across the back and the shoulder. Always use your forearm. I'm sideways to the table. I'm keeping the other hand on top to guide. And I'm literally pushing all the way up. I can angle and come down across the top of the trapezius. This is a very comfortable stroke to receive and an easy stroke to give, and I highly recommend it. And again, once you've done one side of the body, you repeat on the other.